and how it is done. Go to the next slide. Yeah. So how typically the process of sperm washing happens is the the donor, so be it a husband or any donor, collects the semen into a sterile jar, and then that is kept either in room temperature if the ambient temperature is within the specified range, so it's kept in the room temperature, or it is kept either inside an incubator or a testive warmer. So the purpose is to maintain a uniform temperature that is close to 37 degree, and so typically it requires 25 to 30 minutes to get this sample liquefied. WHO recommends close to that, that is 20 25 minutes for allowing liquefaction of the sample. And post liquefaction, and this is very very important that we process the semen only after liquefaction, otherwise either we damage the sperm or we will not get the required recovery. So this is one important quality parameter while doing the process. And there is a way how to check the liquefaction of the semen, that is the sample. So once liquefied, then only we should process it. And there may be some cases where the sample is highly viscous. So there are ways how we can get it liquefied. Talking about different methods of sperm washing, the very basic method is the migration method, which is also known as simple swim up method, where, as we can see, we we take the liquefied semen at the bottom, and then over that we make a layer of culture medium. So let's say if this is 1 ml, then slightly more than the sample quantity, we take the liquefied semen, the culture medium, sorry. So if this is 1 ml, then we take this roughly 1.2 ml of culture medium, and then we keep the tube in the inclined position, preferably 45 degree. And typically, if we have the equipments available, like if we have the incubator, we keep this inside the incubator, and this will take roughly 1 hour uh, for this separation to get completed. And post 1 hour, then the upper one close to 1 ml will be taken out, in which the motile sperms must have already migrated, and then that is used for the further process like insemination, or in case of IVF, the next step, that is fertilization. So this is about the swim up method. This method, though it recovers highly motile sperm, but it has a limited application, because in this the assumption is the sample has a good number of motile sperms. So typically this can be used in case of normal semen, because if the motility is the problem, then this process will not help. So we will be able to only recover the motile sperms. And since this is not even coming in contact with the culture medium, so even the motility will not improve. So we'll not get more motile sperm, which is the case in case of the simple wash and density gradient methods, where we get less motile sperms pre-wash, and post-wash we have more percentage of motile sperms. So this is not the case of in case of swim up method. And then comes the simple wash, which is centrifugation method. So these two methods are centrifugation methods, simple wash and then density gradient centrifugation. In simple wash, we liquefy the sample, and then we mix culture medium in the uh, jar itself, and that is 1:1. That is, let's say, if we have a sample quantity 2 ml, we mix 2 ml of culture medium. So it equal amount of culture medium has to be mixed. And post that, we take that into the test tube, the centrifuge tube, and here the quality parameter which we have to check or to follow is we don't load one tube heavily, meaning one tube we should not take the entire sample. So WHO recommends that not more than 3 ml should be taken in one tube. So if we have, let's say the final preparation, if it is more than 3 ml, then we should split into multiple tubes. So after taking that into tubes, we put this into centrifuge and then we centrifuge it. While centrifugation, understanding the centrifugation parameters is very, very important. Typically, people or the technicians get confused with the centrifugation parameters. The, cent the key centrifugation parameters are two. One is the G value and the other is the centrifugation time. For G value, there is a range specified by WHO which should be followed, and that range is between 300 G to 500 G. In some specific cases, we can go up to 600 G, but not more than that. And this G value is not the RPM. It comes by calculation. There's a formula. So the G value is it's a function of radius and RPM. So we should not get confused with RPM. It's the G value which is important, and we should follow the G value. Otherwise, if we apply less G value, let's say, the recovery will not be as desired. And if we apply more G value, then there will be more damage in the DNA damage, sperm damage. So we should strictly adhere to the G value specified by WHO. So the process is like this. We set the basically we do RPM setting, but then we should do calculation at what RPM any particular machine will give G value in the specified range. So there's a WHO process guideline given how much RPM, basically the G value. Accordingly, you set the RPM. So G value time. So typically it is 8 to 10 minutes in step one, and then pellet formation happens like this, and then we discard the supernatant, and then we mix culture medium into this, then again put it back into the machine, then again run for 3 to 5 minutes. So 300 to 500 G is the specified range. Whether we are in step one or step two, only the timing changes. In case of so typically this centrifugation is a two-step process. In step one, we are running the machine for close to 8 to 10 minutes, and step two is 3 to 5 minutes. And then, so after step two, we get the final pellet, which will be close to 0.2, 0.3 ml of sperm. And then as we either we go for IUI or IVF. So in case of IUI, typically we make the inseminate volume up to 0.5 ml. So we mix culture medium or buffer in the final pellet, and we make it to inseminate volume. Then the next is the density gradient centrifugation. Okay, before I go into the details of this, the choice of method depends upon two factors. One is the quality of input, as I was saying, if it is a normal sperm, any method is okay. But when it is not normal, then we have to select the method in the right way, otherwise we'll not get the desired recovery. So one is the quality of input, and the other is the intended procedure, like IUI, IVF, or ICSI. ICSI, we just need a few sperms, so any method can give me the desired number of sperms. But when we talk about IVF or especially IUI, the maximum recovery is what is intended. So we have to select the method in a right way. So talking about the density gradient centrifugation. So as the name suggests, there are different density gradients, basically the media, what we call reagent. So there is a high density, there is a low density, and then there is a liquefied semen. For density, so there are different combinations, but typically 80% is uh, the composition, I will say. Uh, so 80% high density, 40% low density. That is though it's not specifically written that this is the combination we should use, but that is most preferably used. Even the WHO mentions that. So the other combinations which are used are 45-90, and then there may be some lab specific practices, but these are the two combinations widely used. So the layering is like this: 80%, 40%, and then over that there will be liquefied semen. So again, this being a sanctification method, it's a two-step process. We prepare the sample, and here the important parameter which we should keep in mind is the quantity of sample we are loading over this gradient media. So typically the gradient media comes in pack of 1 ml, 1 ml. So the research says that maximum 2 or 2 to 5 ml of sample should be loaded over this, not more than that. And if we, let's say, try to put all the sample into this 1 ml, 1 ml layer, so this there will be overloading, and in the final pellet, we'll get dead sperms. So that should not be done. So the preparation is like this: high density, low density, culture medium. Though it looks simple, but then it's very difficult. So the principle is like this: how good I make layer, clear, distinct layer, will decide the recovery of the motile sperm. So this layering is a bit difficult. So that requires training, skill, and at the same time, it requires time also. So again, like simple wash, this is a two-step method, two-step process. Earlier in the earlier version of the WHO manual, there was a particular protocol defined for density gradient method. But now in the latest revision of WHO manual, that is 2021, it gives a generic guideline, and it says that we should follow the manufacturer's recommendation while defining the protocol for density gradient method. So uh, step one, again, the range specified for G value is 300 to 500 G. Timing is also similar to what is specified for the simple wash. So we can go for 8 to 10 minutes in step one, and step two, 3 to 5 minutes. And the process goes like that only. We will be there. Let's go back. Yeah. So we do sanctification, step one, pellet formation will happen, and then we discard the supernatant, and then we mix culture medium into that, then put it back into the machine, then centrifuge for 3 to 5 minutes. Again, the G value specified is that. So though it's not specifically mentioned, but we have to follow that 300 to 500 G, the range specified by the WHO. And then we get the final pellet. So if we have to decide what is the best method or the gold standard or we say the default method of sperm washing, we can simply go with density gradient sanctification, because there we don't have to think what method to follow or what's the selection criteria. And so density gradient. So let's understand the. Let's go to the next slide, Chandan. Yeah. If we see the side-by-side comparison of different methods, the three methods which we discussed, swim up, simple wash, and then sit. Okay, so before I go into the comparison of these three methods, there are other advanced methods also which are slowly coming into practice, but those are not widely used. So these are the basic methods. Most of the labs, not just in India, across the globe, these are the methods being used. Simple wash, the positive side is it's a very simple and fast method as we don't have to do layering. We simply mix the culture medium and then put it into the centrifuge. It's cost effective, but at the same time, the simple wash has certain limitations that uh, the final pellet, what we get is not very uh, pure, I will say. Like it has the leukocytes, the immotile sperms also in it. So that's a limitation which we should keep in mind while we try to use simple wash method in our protocol. So typically, this we should use when we are going for ICSI, not for IUI or IVF. Swim up method. So as I mentioned earlier, this gives you, let's say, if we talk about the DNA damage, this is the method which gives us the least possible DNA damage sperms. Because when we go for centrifugation, so though we operate in the specified range which was established after years of research, but still, as we are exposing it to the centrifugation process, there will be some DNA damage. So swim up is the method. So when DNA damage is a concern, let's say some samples have more DNA damage, more DFI. So we we should go with this method because if we go for centrifugation, that will further damage the sperms. This method, as it gives highly motile sperm, but again the recovery will be less. And as I was saying, it does not improve the motility as it is with the other methods. So the percentage motile sperm pre-wash, post-wash, so it will not be much different. And so here, time is a big concern again, if we are concerned about timing. And as we should also keep that in mind that as time passes, if we keep the semen, sperm outside body for more time, there will be free radical release, that is reactive oxygen species. So we should not delay much. That's the guideline. So this process is time taking process. And the density gradient. So density gradient is the process which gives us the best possible recovery and the purest form. If we disregard or if we exclude the DNA damage part, if we are comparing with swim up, then the density gradient gives us the highest recovery or best possible recovery. Yeah, go to the next slide. Okay, so while selecting the method, the key parameters which we should consider is all these, like number one, the media quality. We should, so there are different media available. Like there are manufacturers from India, there are imported media. But irrespective of whether it is imported or manufactured in India, we should go into the details of that. We should always validate the quality of media in our lab. Like even we as a company, when we are working with different suppliers of media, before we introduce any or before we onboard any vendor for media supply, we we test the sample. We also make sure that the temperature is maintained while transporting. So that's very, very important. So selection, which brand you are using is very, very important. And then transport, as I was saying, transport, it happens in the cold chain. So the recommended storage temperature is 2 to 8 degree. So this is usual refrigerator temperature. So the same temperature should be maintained while transporting the media from the supplier place to the clinic. And this we can very easily check when we receive the parcel, the package. We should always check whether the ice packs are melted or not. By that way, we can very easily see whether the temperature was maintained or not. And then while doing the process, the cement preparation. It's very, very important that we bring the media to the room temperature. And how we do is we can put that into incubator or test tube warmer, or even if the ambient temperature is close to 37 degree, we can keep it in room in normal ambience, and then we can bring it to normal temperature. So many clinics whom we have interacted, they they don't follow this protocol. Then ultimately that will impact the recovery of the sperm in the semen preparation. So it's very, very important that we follow the supplier vendors guidelines. So typically the media manufacturer, they will give you a recommendation sheet, how much time prior to using it should be taken out from the refrigerator. So you should always check for that. And let's say if you have not received any recommendation sheet, then preferably at least 1 hour prior to using it, we should take it out from the refrigerator. And then the sample, while sample collection, we should always advise the donor that he should uh, keep abstinence gap of 2 to 7 days. That's recommended as per WHO. And then next is the jar should be sterile, and it should be a wide mouth open jar. And collection should happen, complete collection should happen while doing the collection. So all these guidelines should be properly explained to the donor while we hand over the jar to the donor. And then I was talking about the liquefaction. We should always ensure that the liquefaction has happened completely. Then only we should do the uh, rest of the process, like the preparation and layering and all. Layering, next comes the layering, especially in case of the density gradient. So layering should be done very carefully so that we get a clear, distinct layer of high density, low density, and culture media. And when we talk about centrifugation, as I was saying, the G value is very, very important, which is RCF, relative centrifugal force, and then the centrifugation time. So here we can simply follow the WHO guideline, or we can define, like when we talk about the density gradient centrifugation, we can define our own protocol. But again, it should be in sync with WHO guideline. And then discarding. So again, we should be careful while discarding the supernatant from the pellet. Yeah, next slide. Okay, so those were the parameters which we should consider while doing the process. Now, how should be my ideal sperm washing technique? So these are the parameters. It should be quick, easy, cost effective. It should isolate as much motile sperms as possible, and it should cause minimum damage to the sperms. It should eliminate dead sperms and other harmful cells, including leukocytes and bacteria. And it should eliminate toxic bioactive substances like decapacitation factors or ROS, should allow processing of larger volume of ejaculates. But again, so all these, so when we say larger volume, so it doesn't mean that the tubes are bigger or we put everything into that. So it should have provision to handle more quantity. Like there can be two tubes arrangement or four tubes arrangement like that. And most important, so as we discussed, two parameters, sanctification, the RCF and timing. But again, so someone may say that, okay, different kind of samples may require different set of parameters. But again, doing the exact calculation is not always possible. So the labs can either follow some proven protocol, or we can establish our own protocol by doing trials, validations. We should not simply go by some recommendation. So we should validate it, or either we rely on the validated procedures, and should be repeatable and consistent. So whatever protocol we are following, we should check the result whether this is giving me the outcomes as expected or not. Next slide. Yeah, so here I will stop for talking about the sperm washing, and I handle the questions here, and then after this we talk about the regulatory side, how we should process. So if we are not already an ART clinic, if we don't have the ART clinic license, so how we should proceed for that, I'll talk about that. So here the participants may ask questions. I'll be happy to answer.
So whoever is asking question, just raise your hand there. I will allow to unmute yourself so you can ask any questions.
Or you can also put your questions in the chat box. That will also be okay.
Yeah, that's also fine. Chat window is open from your side, so you can put your question if you're having. Okay, so it means that you all are aware about the things. You don't have any question.
Yeah. So how many of you are associated with IUI, or want to start IUI clinic? Who will? So maybe you can just say yes in the chat box if you are interested to know about how to go ahead with ART clinic license
Sarang Yadav, you can unmute
process.
yourself. I have given you right. You can unmute yourself.
Yeah,
Yeah.
please proceed.
Yeah.
Go ahead.
You hear me? There's some
Yeah.
problem in my chat box. I was not able to type.
No problem. No
So,
problem.
a few questions, sir. I would like to start my ART clinic. I was already practicing ART specialist, but now I just want to start with a little clinic of mine from the IUI clinic.
Okay.
Right.
And
I have already taken a clinic space in Noida Extension.
okay.
So, few questions.
Yes.
First, how to go about the licensing procedure?
Sure.
Though basically I know already.
Yeah.
Second thing, documentation and record maintenance in IUI clinic.
Right. I'll talk about all that. Yeah. Okay. Chandan, that's not there in the presentation.
Okay.
Yeah. Okay. So I assume that you already have your hospital setup, and this will be your ops gynae setup where you are planning to start.
No, this is I'm just no, not my my hospital setup, I have taken a place for IUI clinic
Okay,
and obs-gyn clinic and cosmetic clinic.
okay,
So
okay,
I want to
fine.
start in that. Yeah.
Sure. Okay. So there are two things when we talk about infrastructure, as I mentioned earlier in the presentation. You should have arrangement for andrology, right?
Yeah.
Semen
Yeah.
preparation, and preferably if you can have semen analysis also, because that doesn't require much of space. What you need is
Right.
microscope and the sperm counting chamber.
Hmm.
So you can have a table where you can keep the microscope and the sperm counting chamber. It's a small device which has to be used. So
Centrifuge.
yeah, so that's on the semen analysis side. And on the semen preparation side, you need centrifuge. Okay. So, uh, assuming that you have a space for andrology and
Yeah.
insemination. So, insemination
Yeah.
is your usual, like your obs GYN is set up where either the labor room or the OT or anywhere you can say that this is my insemination room. So,
Okay.
andrology and insemination. That is what you need.
Yeah.
Okay. And
Yeah.
then comes the equipment. As per
Hmm.
ART rules, you need three mandatory equipment. Number one is microscope, number two, centrifuge, and number three, refrigerator.
Any
Okay.
refrigerator. Yeah.
So it's your typical refrigerator what we have in the hospital. It's like a household refrigerator only, because what the purpose of refrigerator here
And
is
so,
to
hmm,
keep the reagent, the media, which
media.
requires 2
Hmm.
to 8 degree storage temperature.
Right. Right.
So, so these
And
are
so semen collection room.
so semen collection is typically done in the washroom. So that's the usual practice. So though if we
Okay.
refer the old ICMR guideline,
Mm-hmm.
specified or it mandated a separate room for semen collection with
Mm-hmm.
the arrangement of some audio visuals to help in the semen
Hmm.
ejaculation and all. But those are now not a part of guideline now. Okay.
Okay.
The usual practice is we send the donor to the washroom. We give the jar
Okay.
and then send
So
to washroom.
routine washroom can be used.
Yes, yes, that's the
Okay.
usual practice.
Okay.
Otherwise, if we just try to follow the old ICMR guideline, then it requires a separate semen collection room. But I have not seen, or even the rules, the ART rules doesn't specify that.
Okay.
Yes. So we have that, and then in terms of staff, so I'm assuming you are a gynecologist.
Yeah.
Yeah. So it says that in terms of staff, it's just a gynecologist who is mandatory. And
Yeah.
practically, if we see, then we need someone to take care of semen analysis and sperm washing. So basically, the
Hmm.
andrology technician is what we need.
Yeah.
But again, so the rules doesn't mandate that you should have dedicated resource for that, or any particular qualification or experience required is not specified. Unlike
Okay.
IVF, where
All right.
for all the staff, there is a specific training, experience, qualification required in case of
Right.
level 2, that is IVF.
Yeah.
Okay.
Yeah.
So we have infrastructure, we have equipment, we have staff.
Hmm. Hmm.
The next is when we fulfill these three. Next
Hmm.
is we apply for ART level 1 clinic online.
Hmm. Hmm.
Okay. So so if you're interested, I can take you through the process of application submission.
Hmm.
Okay.
So it's
Uh,
same for all over India?
yeah, yeah. So it's the central
First.
registry. So maybe
Okay.
quickly I can show if others are interested as well. I'll quickly take 2 minutes, and then if you want in detail, if you want any kind of support there, we can plan a separate meeting for that online meeting.
Okay.
So let me just take you through the registry.
Sohan, another
Yeah,
question is here.
yeah,
Does 300G for 5 minutes increase the DFI from
yeah.
Durva?
I'll answer to that. Yeah. So okay, Chandan, can you allow me to present my screen, or if you can open from your side ART surrogacy registry. I think if I share, then that will be better.
Okay, let me stop sharing my screen. You can share it.
Yes.
Sir, ultrasound is not mandatory, though I'm planning to
For
keep it
level
in
1,
clinic.
it's not mandatory.
Okay.
For IUI clinic, it's not mandatory.
A few of my friends were telling if you want to fill the form, they asked whether you have an ultrasound or not. So I was wondering, till I wait for PCP entity, then apply for ART clinic, or do I do it simultaneously both?
So it actually, so the purpose of asking that question while filling the form is, if you have ultrasound, then you should be compliant. That's the expectation. So that means when you are having USG ultrasound, you should have PCP entity license. So
Hmm.
it's just collecting information that you are compliant. It doesn't
Hmm.
mandate you to have.
So I can apply both. Meanwhile, because PCP entity will come, take 2 to 3 months to come.
Right, right. So these are two,
Certification.
okay, so these are two different things. So what you can say that you can do your ART clinic license thing separately and PCP and your USG thing separately. So what? So let's say today you are filling the form. Today you don't have license. So you say no, you don't have PCP entity license.
Okay. Okay, that will not hamper the ART level 1 license.
No, because
Okay.
that's not a mandatory requirement.
Okay. And I can show I have added later on.
Yes, yes. So later, once
That's
you
not
get
an
it, and
issue.
anyway, it's the same authority. The for ART clinic license application process,
Hmm.
the PCP entity is one of the members of the inspection team.
Hmm. Hmm.
Okay. And another information it takes is whether you have MTP license. So again, it's not a requirement.
Hmm.
It's collecting information that if you're doing MTP, then you should be
Hmm.
compliant. Okay.
Hmm.
So let me take you through the registry. I hope my screen is Chandan. My screen is visible.
Yeah, we can see
Yes,
that.
yes.
Yeah.
Yeah. Yeah. This is the registry, and it's a national registry. Okay. Common all across India. So what we see here is the dashboard. These many clinics have already applied for the license. These are the approved ones, and these are the rejected ones. And
Hmm.
similarly, so this is ART clinic, the ART bank, and then surrogacy clinic.
The
So what?
rejected ones are also there. Yeah.
Yeah, they are rejected ones.
Okay.
So yeah, so so this includes both level 1, level 2,
Hmm. Okay.
and there can be some valid reason why those are getting rejected. If we don't follow the
Okay.
guideline, then definitely there are chances of rejection. Though in case of IUI, the requirements are minimal, but again, then we have to comply with that. So there may be cases where even the hospital or clinic does not have a gynecologist, but then they might have applied for it. So in that case, definitely it will get rejected because there are cases where the BAMS doctors, they are also practicing gynecology, right? After doing MS in Ops Gyne. So actually, the regulation doesn't allow them to start IUI clinic. It allows only the usual gynecology like MBBS and PG Ops Gyne. So BAMS is not allowed. Okay, so it works like this. So we first sign up, we fill this form, and then when we go inside, we see another form. Basically, that's the form. This is a sign up page where we fill all these details, and then there will be login ID, password created, and then we fill the form, submit it, and once we submit, there is one PDF generated which we need to take print out, sign, stamp, and then submit it to the PCP entity or the ART local authority. So typically it's the ART office or the CMO office where we need to go submit the form, pay the fees of 50,000 rupees, and then your application process gets completed. And post that they come for inspection, do inspection, and then so typically after we put the application, pay the fees, it is expected that within 30 days the inspection will happen, and post inspection uh, we can expect the license in next 30 days. So that's the ideal timeline. Any further questions on this?
No, sir. No, sir.
Yeah. Okay.
Documentation and record maintenance
Yeah.
later.
So
Two questions,
while
sir.
yeah,
Sorry to interfere.
yeah.
Whether we can do donor IUI also at the clinic?
Right. So
We can.
you don't have to apply for a separate license when we are applying for level 1 clinic license. So okay,
Hmm.
let me just show you some form which are already submitted. Let's say this one. So this is the form which is basically generated after submitting it. Okay, as you see here, it takes the details, what all processes you are going to do. So here, this is a normal IUI and donor IUI. So you have to just say yes.
All right.
You don't need to apply or submit any separate form. Okay, so this is how the process works. Okay, let's go back to the chat. Okay, yeah, Chandan, where's the question and what was it? Can you please repeat? Chandan,
The
I don't.
documentation.
Yeah, on the document. Okay, so there's another question on the DFI, the process side. Okay, let me answer to the documentation side. So while submitting the applications, the office may ask you to share details about the gynecologist registration, and if you have PCP entity license, they may ask for PCP entity license for USG, and similarly for MTP, they may ask about the license, and in some cases, though the regulation doesn't specify, but then they may ask details or proof of the equipment you have, like microscope, the centrifuge and all. So those are the documents at the time of uh, your application submission, and then related to your hospital, like clinical establishment or nursing home act license. So basically your hospital license is what they look for, and then post your license receipt during your the regular compliance, the consent forms are important. Okay. So for different activities, there are different consent forms, and all those forms are available in the ART regulation document. If you are interested, I can. So this is the ART rules document, which gives all the details about anything and everything required for IUI clinic, or basically level 1, level 2, everything is specified here. Okay. And in this, see all the forms, like the one which we saw just now is this form, the form 1. So though this is for a reference, you don't have to do it offline. It's always accepted online only. Okay. So though the notification says that you can do online offline, but practically it is happening only online. Okay. So this is form 1, and then there will be different consent forms. This is for the ART bank certificate of it. So this is what is issued. This is the template. So this is the consent form. So these all the consent forms are here. The details what you need to prepare. So here actually you need to prepare your own format for these consent forms. But what content should be there is specified here. Okay. So the consent forms, maintaining consent forms is what is very, very important. And then at required frequency, or there is a certain guideline. So you need to keep record of all the ART procedures you are doing, and the authority may ask the details about the number of procedures done, the outcome, the protocol followed, and all. So compliance is very, very important while we already get the license and start doing the IUI. Does that answer your question?
Yeah, thank you. Yeah.
Yeah. Okay. Any more questions on this?
So for how long we have to maintain the records?
With
Consent.
consent, so I'll have to see that because there's no particular timeline specified.
So 1
So
year, 2 year, 5 years, like something like that, you know?
I right now I don't have answer for that. Maybe I'll look into it
All
and
right.
I'll answer to
Okay.
that. But
Okay, thank
typically,
you.
I assume that we have to maintain for at least 10 years.
Okay, 10 years. Okay.
Yes. Okay. And then there was a question related to the process. Chandan, where I can see the question?
I think he messaged to me.
Okay.
Question is, does 300G for 5 minutes
Okay.
increase the DFI?
Okay. So the straight answer for that is no. DFI 300G. So as we go higher on the RCF, that increases the chances of DNA damage. So it's not just a 300, which is because 300 is the least range or least value of G which is specified. So in fact, that is a safe zone where we should operate. Yeah. Any other questions?
Any other question? If you have, just raise your hand. We will be happy to answer your questions. You just need to raise your hand, and I will make unmute yourself so you can.
Yeah.
That
So
you
we
can.
have another question. Yeah. How should the infected samples be discarded? HIV positive samples. Okay. Yeah. So, number one, when we are handling these kind of samples, so preferably we should go for the density gradient method, not the other methods. And then, uh, so the general guideline is whether it's infected sample or not, we should treat this sample as a biohazard. So we should take, so first thing is protection of the operator, the technician who is doing that. So we should take all the precautions. And then, so here what will be important is when we are doing density gradient, so there is a pellet formation, and then the supernatant that should be discarded properly so that it doesn't get mixed up or it doesn't come in contact with either the person or any other objects which are in the surrounding. So all those should be taken care while handling these kind of infected samples. And so like during the process we can take out the pellets separately, transfer to the other tube. So we should take maximum precaution to avoid any kind of spread of infection in whatever way possible. Yeah. Any other question?
No, I don't see any questions. So can we proceed now from there?
Yeah.
And just keeping mute yourself, Taran. If you have any question, just let us know.
Sure. Thank you.
So we have 2 more minutes. If you have any questions, please put your question either in chat box or you can unmute you can raise your hand and we allow you to speak.
Yeah, Taran, you have. You can unmute yourself. I have given you permission. click unmute from your system. Yeah.
Yeah.
So
Please
can
go
you
ahead.
tell us something about the Subhag equipment?
Yeah. So, anyone of you are interested to know about the Subhag product, that is Androwash, you can continue. We can talk about that. Okay, so I'm assuming that we have no more questions on the topic of today's webinar. We'll proceed into the Subhag product.
Next.
So this is basically the automatic sperm washing centrifuge, Androwash. So here, what we have special in this is, so as I was talking about having a standardized process, the requirements I mentioned, quick, consistent, other factors. So what the knowledge gap what we have seen in especially in case of the level 1 clinics, okay, when we go to the level 2 clinics we have the embryologists who take care of the semen preparation, but in the IUI clinics, the level 1 clinics, we are either depend. So in many cases, the gynecologist himself or herself is doing the semen preparation, but in other cases where we have a technician, so if the technician is not fully trained like an embryologist, so we have seen a lot of knowledge gap, and that starts from the quality aspects, as I was saying, that selection of media, the parameters, and all. So two key parameters which we if we don't take care of that, then we are actually not going doing justice to the process, and then ultimately will not get the success in the process. Is so let's say I have a conventional centrifuge, so I need to understand what RPM is going to give me what G value. Okay. So understanding of that is very, very important, and then calculation and all. So I need to be expert to do right sperm washing. Otherwise, I can simply do a swim up method or simple wash. But then to do sperm washing in a right way, in a compliant way, either I need to become an expert like an embryologist, or I should have some standardized process where there's no chances of making error by operator, the technicians. So this is the machine which is basically eliminating the chances of error being done by the technicians. Okay, so what we have here is this is a pre-programmed machine, and this is based on density gradient centrifugation. Okay, so when we say density gradient centrifugation, we need to make layer of the reagents like these are the density gradient media if I'm visible, 1 ml 1 ml, and then this culture medium. So what we need is we need to make layer of high density and low
It's
density.
not, it's not visible.
Not visible.
Not,
How?
nothing on screen. No, nothing on
Actually,
screen.
Okay, Chandan, can you see what's the problem?
Mm.
Chandan, are you there?
yeah.
Do
Yes,
you
I
see
can
my
see.
video? Are you able to see my video? Or you can pin my video so that others can see. Yeah.
Yes.
Now are you able to see my video?
Yeah, clearly. Yeah.
Yes. So I explained about the importance of making good, clear, distinct layer in the density gradient method. In other methods like the swim up method also, the layering is important. But in case of density gradient, it's very, very important because the principle itself is based on different densities. So if I don't make a good, clear, distinct layer, I'll not get the desired recovery. So what we do is we first take the high density. Let's say this is my high density, and then we have to make layer of low density. So so I'm using plain water as a low density, and this blue color water as a high density. So this is high density, and then I make layer of low density. So different technicians or embryologists, they may use different techniques, but and in the end, what we need is skill, practice to make a good, clear, distinct layer. If I'm not trained enough, I don't know the technique, or even in any case, the time required is more. And so if I do it fast, so this takes a lot of time. Then only I may be able to make layer. Otherwise, if I do it, then it will actually go and mix up. Okay. So this problem we have tried to de-skill this process. So what we have is, as you can see, the difference. This is my conventional conical bottom centrifuge tube, and this is the one developed by our team. As you can see, this has an extension at the bottom, cylindrical extension, conical, then cylindrical extension. And then in case of conventional centrifuge tube, we have just tube. Here we have a cap attached with a microfluidic tube, which opens at the bottom on two sides. So this mechanism, this helps me in layering and in a very quick and a standardized way. And for layering, we don't use this pipette. Instead, we use this 1 ml syringe. And we have reversed the sequence. In the usual process, we take the higher density first. Here we take the low density first. Okay, like this. I hope my video is properly visible. Chandan?
Yes, it's visible.
So I'm taking the high density now. You see how clear, distinct the layer has formed. So this layering has become very quick, easy, and consistent. This kind of layering we can hardly achieve in the conventional process. So that's the difference. And post this, we remove the cap. Allow me 1 minute. So after this layer has formed, we remove the cap like this. And then we layer the liquefied semen now after this. So that we do with the help of pipette. We take the liquefied semen and then tilt it and release it over the wall just above the layer without disturbing the layer. So this step will take 2 to 3 minutes, depending upon the quantity of the semen. And slowly we take it out like this. So this way my preparation is done, and then I put a normal cap like this, and then my sample is ready now. This preparation is done, and then now comes the machine. So it is like this from inside. You can see this can process maximum 2 samples at a time or 2 tubes at a time. And when I have, let's say, less quantity, up to 2 ml sample, then I take only 1 tube. That time the other side will be a balancer tube in which I fill plain water. So it's done. Now I put the cap, close it. There will be power supply from here, and then we have only this button. So we don't have to do any setting of timing or RPM, nothing. So just press the button. When I press the button, it runs at a specified RPM or specified time. And after that, it stops. There will be buzzer sound, and that buzzer sound will continue until someone comes and does the next step. And that next step is remove the cap, take it out, and then so as you know, as a result of centrifugation, the live motile sperm gets settled at the bottom, which we call sperm pellet, and over that there will be supernatant, which needs to be discarded. So in the conventional process, we typically do like this. We use the pipette and separate it like this. So again, we need to be careful. Otherwise, if we don't handle it properly, there are chances of mix up again, or I may not be able to discard the supernatant fully, or I may be discarding the pellet. So nothing is desired. Here, we remove the cap, and then we do this. The pellet remains here. And this is designed in such a way that it can accommodate the pellet volume. So it's a two-step process. After this, I mix 2 ml of culture medium into this culture medium, and then gently shake it, put it back into the machine, balance. So if I have samples in 2 tubes, I have to repeat the process for the other side. If I have one, then so in any case, the levels on both the sides should match. There's a basic requirement. Otherwise, there will be unbalance and there will be heavy vibration. So balance the water level. If assuming it's only 1 tube sample, place the lid, press the button. Now when I press the button again, it runs at a specified RPM for specified time. Again, there will be buzzer sound. Stop, then take it out, do this, and then I get the final pellet, which I use for IUI IVF. When we are going for IUI, mix the buffer, culture medium, make it to inseminate volume, then load that into cannula. So this is the whole process. Yeah. So we are open for questions on this. Anything? Any questions? You can raise your hand if you have any questions on this.
So, this is compatible with the ART guideline.
Yes.
The
And
centrifuge method. This
yes. So
we don't need other centrifuge if we use it.
It's a centrifuge only.
It's centrifuge only, right? Yeah.
Yes.
They will acknowledge it.
Yeah. In fact, so we have many centers where our machine is installed, and they have already got license.
Okay. And in the similar method for other purpose, if I need PRP, we can make PRP also in that.
No, so this, as I said, so different fluids have a different set of sanctification parameters required. This is designed to handle only sperm, semen.
Okay.
If you need for PRP, then that may require a different set of parameters. So we don't recommend using this for PRP.
Okay.
Yes. Okay. Any other questions? Okay, we'll wait for 1 more minute, Chandan, and then we conclude the
Okay,
session.
okay, fine. Hello everyone. So I have sent you the one feedback form. Please, you must share your feedback about the session. You want to have this session on the regularly. So we are hosting this session. So we will update you on the upcoming session. Okay, one question is here. Okay, Shohan, there was one question earlier.
Okay.
What are the some career opportunity for PhD scholars in ART clinic? Another question from Vivek, how much temperature should be maintained and how long we can use this sample? Two questions are here.
Okay. And where I can see the questions?
I think they sent to me, but in the chat
Okay.
box
Okay.
I have
Fine.
sent
Fine.
to,
No.
yeah,
No. No problem. Okay.
yeah.
So specific to PhD. So PhD in which stream? That's important. Okay. But if I have to answer in a straight way, uh, there's no any requirement as such in ART regulation or in the ART clinic for any PhD. And so if the PhD is in embryology, so that's one relevant field. So yeah, so for that, yes, there is a career opportunity in the IVF center, the ART level 2 clinic, not in level 1. But again, having PhD is not a requirement for any staff in any ART clinic. Okay.
Uh,
And
but but maybe another career opportunity, not only the restricted to ART clinic or IUI clinic, but he means to say about other thing like research options as well. So if you can guide him, that will be also helpful for him.
yeah, again, so depends what is the stream of the PhD you are into. So based on that, because I cannot simply say what's the career opportunity for a PhD unless I know what's the background he or she is coming from.
Okay. So another
So
question is
maybe
here.
if there is any specific input required, so you can reach out to me or Chandan. We can help you with that.
Okay. So another question is how much temperature should be maintained and how long we can use this sample?
Okay, so depending upon whether we are talking about IUI clinic or IVF clinic, so when we talk about semen processing, whether it's semen analysis or sperm washing, the ideal ambient temperature is 37 degree. Okay, so we should try to operate close to 37 degrees. So though there is the range of temperature specified by WHO, uh, when we say room temperature, so it's between 23 degree Celsius to 37 degree. But we should try to be close to 37 degree. That's the recommended temperature. And when we say for how long we can keep the sample, so let's understand like this. We So the donor ejaculates into the jar that is allowed in room temperature or incubator for half an hour for liquefaction, and then the processing time depending upon what method we are doing. Like when we go with our method, the Androwash method, it takes 18 to 20 minutes. And when we go with conventional method, depending upon whether we are doing swim up or simple wash, density gradient, that may require time, different times. So then post processing, that is post sperm washing, we should inseminate as soon as possible. That's the guideline. Even WHO says like that. Reason being, as we delay the insemination or the post processing, we are actually increasing the chances of reactive oxygen species, ROS generation, which actually severely hampers the vitality and it damages the DNA, basically increases the DFI. So the simple guideline is complete the process as soon as possible. The only restriction is on the liquefaction side. We cannot reduce or we cannot play much with the liquefaction time. So once the liquefaction has happened, as soon as possible, we should complete the washing as well as insemination, especially when we are talking about IUI. We should not delay the insemination once we get the final pellet. And so there's no any, let's say, any recommended allowed time or delay time after we wash it. So as soon as possible, that's the guideline.
Okay,
Yeah.
so
Any questions? Any
yeah,
more questions received, Chandan?
no, I don't have any question now. So I will share the presentation. So you can have anything, so share. This is the thing that we have done so far. We have installed Androwash in different hospitals in the pan-India basis. So you can see that. Okay. This is thing already.
Yeah, this we have already talked during.
Yes.
And just be here, Chandan. Yeah. So final. Yeah. So it's very important that when we are talking about semen analysis and sperm washing, there is a WHO guideline which we should refer. So it gives you what all parameters we check as a part of routine semen analysis and all. So simply we should always refer WHO guideline while we are doing any kind of andrology activities. Yeah. Okay. Okay. So if no more questions, we can conclude the session. Thank you so much, all the participants. Chandan, thanks for hosting this. Thank you so much. Bye bye.
Yeah. Okay. So I've already shared the link. So please share your feedback with us. So that will be help. That will motivate us. That how is the session? What do you want to know? If you have any specific query, any question, you can feel free to share that feedback with us. Dr. Tarang Yadav, I will be in touch with you. I will arrange a call. If you need any help to set up registration, Sohan will help you to set up a call with you and guide you how to do the registration and all for IUI clinic. Yeah, thank you. I'm just ending the session. Thank you everyone for joining this wonderful session.